I'm Amy Hollingworth, the Director of Safe Sports Network, and we're here with Dr. Erik Swartz to talk about the newest consensus statement on concussion. Thank you for joining us, Dr. Swartz.
Sure.
What we're looking for is, can you tell us what you feel the most important takeaway point from the new consensus statement is, as far as regarding coaches, parents?
Yeah, for coaches, parents, and even players themselves, I think it's really all about the recognition. And even though this document, which culminated in activities up till 2016 in Berlin, and then the paper was published in the British Journal of Sports Medicine in 2017, I think while it's geared towards the practitioner and the healthcare provider, that parents, players, other stakeholders who are there at that time of suspected sport-related concussion is just to recognize it for what it is and be aware of any signs or symptoms or even the suspicion of a potential sport-related concussion, and that child, that athlete, should be removed from play, assessed in even just a simple screening recognition process, which the document provides, a concussion recognition tool, which is just a one-page simple process to kind of go through as a screening mechanism that anyone can employ, and that gives a fairly accurate depiction on whether or not there's a suspected concussion, which then a healthcare provider can go through a thorough assessment. It also would provide red flags for initiating an emergency response and calling 911, because of course concussion is kind of on the spectrum of a traumatic brain injury, and there may be some underlying emergent issue that would need to be identified.
Dr. Swartz, can you tell us what you feel is the most important takeaway point for healthcare providers in regards to the new concussion consensus statement?
Yeah, and it's hard to pick just one, actually, because there really are a lot of very important takeaways and literal updates, and that's what the process was and the document is. But I think a few things that come to mind, which are important for healthcare providers, would be to really appreciate that this injury is an evolving injury. So sport-related concussion typically, obviously, results in immediate, transient symptoms, but there may be symptoms that don't show up for a day or maybe even 2 days, and symptoms can change in their magnitude or how they're presenting themselves. So I think that the fact that it's an evolving injury is really important for healthcare providers to understand. Also, what has become, I'm pretty sure, better understood and embraced is that in the early stages of treatment for sport-related concussion, that rest is important and it plays a role, but it's really only in the first 24 to 48 hours that complete rest, absolute rest, is the mode of treatment, before you then should slowly and responsibly increase cognitive activity and maybe even exercise or aerobic activity along with their course of recovery. In other words, to just suggest that in years past that you should have someone completely rested, no cognitive activity, no TV, no phone, until their symptoms are resolved, that's not the best way to treat these injuries. Is that it's rest is appropriate for 24 to 48 hours, but then begin a gradual return to cognitive and even physical activity.
Excellent. So in terms of returning to school, as far as being out for, traditionally maybe saying a week and then maybe going back, that's kind of changing the ideas, or
it's more about hitting important milestones. We do have an idea of how long these injuries do take to recover, but sometimes the symptom recovery may not align or correlate exactly with the actual cognitive recovery that's underlying. So the Berlin document again has the graduated return to sport or return to activity progression with a table and then descriptions on how to follow that, as well as return to school strategy that, again, is a graduated, I think it's a 4-step process for return to school.
Excellent. What would you say is the biggest buzz around concussions and the new concussion consensus statement?
Well, probably the most buzz right now are concerns around repeat concussions, but then also these quote-unquote subconcussive impacts. So it's an accumulation of just head impacts, typically categorized or described as just simply head impact exposure, whether there's concussion or not. And it's the accumulation of those that more and more evidence is beginning to suggest that that can be problematic in the long term. And so that's probably the buzz right now, but this document still is very focused on concussions itself, treating concussions appropriately, assessing them and recognizing them for what they are, and maybe what more efforts can be directed towards rigorous research for preventing concussions in the first place and trying to decrease that overall head impact exposure.
Excellent. Well, thank you for your time, Dr. Swartz, and
Absolutely.
have a great day.
All right, thank you.